Spine surgery is usually permanent. Once the bone is cut and the metal goes in, there is no hitting the undo button. As a spine surgeon, I consult with patients every single day and I'm constantly shocked by how many people agree to major life-altering surgery without asking the right questions. If you or a loved one are considering back or neck surgery, you have to take control of your health. Today, I am giving you the exact 5 questions you must ask at least your surgeon before you ever sign that consent form. Few questions might actually offend your surgeon who is going to perform a surgery on you. But yes, you need to get clarity before you go under the knife. Question number 1. Have we truly exhausted all non-surgical options? Except in cases of severe trauma or severe pain or loss of bowel and bladder control, spine surgery should be your absolute last resort. You need to ask your doctor if physical therapy, targeted spinal injections or weight management could solve the problem first. If they rush you to the operating room without trying conservative care, prefer a second opinion. Question number 2, a bit tricky and also might be offending, but you need to ask this. How many times do you perform this exact surgery every month? This is the one that shouldn't offend a good doctor. Spine surgery is incredibly complex. You do not want a surgeon who does this procedure once in a year or once in a month. You want a specialist who does it frequently, let's say every alternate day, because high volume means less complications, better experience. Question number 3. What are the most common complications and how do you handle them? Every surgery carries a risk. Probably infection, nerve damage, or the bones failing to fuse, or the implant failing. A trustworthy surgeon won't sugarcoat all this. They will tell you exactly what can go wrong, and more importantly, they will also tell you their exact medical protocol for fixing all these complications if it does occur. And question number 4, what does a successful outcome look like for me, for my particular condition? This is very crucial. Sometimes the goal of spine surgery isn't to take away your backache. It is to stop your leg from going numb and prevent permanent nerve damage. If you go into surgery expecting to feel like an 18-year-old gymnast, you might be bitterly disappointed. You and your surgeon must agree on realistic goals. And finally, you need to ask the question, what is the exact timeline for my recovery? Yes, the nerves heal at a pretty slow rate. It does differ from patient to patient. Let's say a patient is having a thyroid problem or a diabetes because of old age. The exact timeline for nerve healing is pretty less in all these patients with diabetes, thyroid related issues or old age. Younger people can definitely have a quicker healing time. Also, you need to know when you can drive, when you can return to work, and how much physical therapy you are going to need post surgery. Knowing this prevents panic when you don't feel perfectly healed 2 weeks after the surgery. I usually counsel my patients who are undergoing disc surgery, either it is a discectomy or a decompression or a fixation, either to their lower back or to their neck, for few weeks, that is probably 3 months time, with few lifestyle restrictions. I usually prefer them not to bend forwards or lift any weights, and I specifically recommend them for not sitting more than half an hour in an unsupported chair or a sofa. And I also recommend them not to strain for passing the stools in the washroom. I request them to consume as much as good fiber diet along with more quantities of water to have a strain-free passing of stools. Also, if my patients are asking me when they can drive, I preferably say if it is a 4-wheeler drive, they can usually go back to the driving within 6 weeks time. But if they are preferring to drive a 2-wheeler, they should probably wait for another 6 weeks. That is a complete 3 months restriction from driving a 2-wheeler. Taking control of your health doesn't stop at the surgeon's desk. Your body needs massive amounts of specific nutrients to survive the trauma of the surgery. To heal your spine twice as fast, refer to my video on diet after spine surgery. Subscribe, stay informed, and I'll see you there.